Hi guys, I'm Dr. Jen Caudle. I'm a practicing family physician and an on-air health expert, and I'm also a video creator. I do videos every single day on every health topic you want to know about, from COVID-19 to colon cleanses to minerals and vitamins, supplements, and oh, so much more, you name it. Guys, thank you so much for joining me. If you're interested in content like this, make sure you subscribe to my channel, click the little bell for updates. Okay, today we are talking about zinc supplementation. That is right. So many of you have asked me, can zinc prevent COVID-19 or can zinc treat COVID-19? This is one of the big things you guys are wondering, and you're wondering if you need to be taking a zinc supplement. Well, we're going to break it down today. Guys, it's so good to see you. Well, let's first start talking about what zinc does in the body. Now, I'm not talking about zinc supplements. I'm just talking about what the mineral does in the body. By the way, it's super important. First of all, you should know that zinc is the second most common trace mineral in the body. Super important, like I said. It tends to be found in cells, and it helps the immune system fight off bacteria and viruses. Okay, now we're getting somewhere, right? Super important. In addition, the body needs zinc to make proteins and DNA, and zinc also helps wounds heal, amongst so many other things. And we know that decreased zinc in the body may increase the risk of infection. But that still leads you to asking, well, okay, that's really, really great to know, Dr. Jen, but does that translate to me needing to take a zinc supplement to prevent or treat COVID? Well, this is the answer. According to the NIH, this is what the NIH says about zinc supplementation for COVID-19. This was updated July 17, 2020. The NIH says, first of all, there are insufficient data to recommend either for or against the use of zinc for the treatment of COVID-19. Guys, I'm going to say that again, okay? The first statement is there is not enough data. It's insufficient to recommend either for or against the use of zinc for the treatment of COVID-19. In addition to that, the NIH further goes on to say that the COVID-19 treatment guidelines panel recommends against using zinc supplementation above the recommended dietary allowance for the prevention of COVID-19, except in a clinical trial. Guys, this is super important to know. So basically, there are no firm recommendations for the use of zinc at this time. Now, what I should tell you is that there are a number of clinical trials that are in the works. We are looking at zinc and trying to understand what it may do, what it doesn't do, etc. That is really, really important to note. But we should also talk about zinc, like just vitamin supplementation in general, okay? I've done videos about vitamins and minerals and things like that and supplements. And, I'm a big believer in that, we need to be careful and thoughtful about supplementation. Just because it seems natural, it sounds natural, it's a vitamin, it's a supplement, it's a mineral, it must be good. That is wrong thinking, because it is possible, for example, to overdose on vitamins and supplements. It is possible to have adverse side effects from vitamins and supplements, etc. I'm not saying that they're all bad and that they're not needed. What I'm saying is that it's on a case-by-case basis, and you should be talking to your doctor. And you should not assume that because it sounds good, it is good. It's important to remember that just because zinc helps with our immune system doesn't mean that if you already have enough zinc in your body, taking more will give you even more protection. It doesn't quite work like that, okay? Don't assume that just taking zinc to boost your immune system is going to do just that. In fact, taking too much of vitamins and supplements, can actually cause adverse effects. We know that long-term zinc supplementation can actually cause copper deficiency and a myriad of symptoms, among other things. So, keep this in mind. The bottom line is there is no definitive evidence to suggest that zinc prevents or treats COVID-19. We have clinical trials that are ongoing at this time, and there is no firm recommendation to take it for either of those reasons. What I would say to you is this: if you are still interested in taking zinc or some other supplement or vitamin, please talk to your doctor. Talk to your doctor, get their advice, see what they say. Guys, thanks so much for watching this video. Please share it with others. If you're not subscribed to my channel, please consider doing that and clicking the little bell to get updates, especially if you like content like this. I do a lot more. Got a lot more for you. Anyway, guys, I will be back soon. Keep it locked here.